Thank you. Thank you, everybody. I'm supposed to read the disclaimer, except that I'm the owner of Primal Air, and we're going to just talk about that for a minute at the end. But nobody paid me to be here. I'm here on my own dime. So we're going to talk about personal infection control and nasal breathing. There's my little tiny resume here of things that I've done. I've been a clinical dental hygienist from 1986 to about 2003 when I switched over to do writing and speaking on preventive topics for dentistry and dental hygiene. And I've written books. I have a podcast that's kind of on a fade right now, and I've just done a bunch of different things just in an effort to support everybody in the dental world, including the patients. And the topic of the day or the moment is the difference between mouth and nasal breathing. What really is the big deal with mouth breathing? Who cares, right? And it is all about, it's not all about it, but a big part of it is this molecule called nitric oxide, not to be confused with nitrous. And now that I jinxed myself, I'll probably mix them up for the rest of our time. But it was the molecule of the year. It is made throughout the body, and there's a very big concentration of nitric oxide in our sinuses, made by our tissues in the sinuses. So I looked up nitric oxide and virus back in this time last year, and we've got a few studies looking at the effects of nitric oxide against viruses. We know that the nitric oxide is responsible for vasodilation, oxygenation, phagocytosis, and the sinus epithelium produces nitric oxide continuously. A couple of studies here. Sinus epithelium synthesizes nitric oxide continuously. Oh, I just said that. And this is why nose breathing is so critical in these times of high infection rates. Let's just say it that way. Nitrous oxide does play a role in critical role in viral infections, and this was a couple of years ago already, and they found that nitric oxide rapidly reacts with the proteins or with the hydrogen peroxide to form this other compound and these other compounds, which are very, very toxic. Pardon my French, doesn't go that far. So nitric oxide as a possible treatment for COVID-19 has also been explored in a number of different ways. Now, you can get nitric oxide as a supplement, and maybe that would be helpful as a system-wide kind of a thing, but nitric oxide is very unstable and it breaks apart pretty easily. But it's very much made in our sinuses, and that's where the oxygen and that's where the air is supposed to come through in order to be cleaned up before it gets anywhere else. Here's some more nitric oxide or COVID-19 nitric oxide studies that is really capturing the imagination of a lot of researchers, partly because it is so handy. And this is why when people are wearing a mask under their nose, I'm like, who cares? Because nitric oxide is going to wipe everything out. This is an artist's rendering of how it attaches onto the tissue in the back of the nose and in the sinuses and back in the oral pharynx. Nitric oxide, you can't read any of this, but rest assured it has been studied on a number of different viruses, including Epstein-Barr, rhinoviruses, and a whole host of others. And it's been very effective at killing many of these viruses, especially these envelope viruses, that it really just kind of takes them out. So I feel pretty confident in recommending nose breathing in situations like this. Does anybody know who Patrick McKeown is, or McEwen? He's the author of the book Oxygen Advantage. He just has a new book out now that I can't remember the name of it right now. But he has a YouTube video on how to breathe in a crowd to protect yourself from these viral loads. And his advice is to hold your breath after an exhale and allow the nitric oxide to pool in your sinuses for as long as you can, and then take that first inhaled breath through your nose, and that will help to reduce your viral loads. And really what we're talking about is what's happening in the craniofacial respiratory complex, what we used to just call the craniofacial complex. So Dr. Kevin Boyd, who is a pediatric dentist in Chicagoland, has come up and has been promoting this term to reflect everything that's happening in the face of a growing child in particular for his purposes, but encompasses everything. It's not just the face. It's not just the forehead. It's everything back in here. That's where the breathing is supposed to happen, and that's where all the shortcomings are showing up first, as we heard this morning with all three of our speakers. This is one of the first studies done by an orthodontist back in 1984, looking at how mouth breathing changes the shape of the face. And what he did is now considered to be cruelty for animals, but I think we're all grown-ups in here. I don't think there's any youthful people in here that are going to be offended by my next pictures, because I always have to have some offensive photos. So what he did is he did silicone nose plugs in a group of apes, monkeys, and a group of not. And this is what he found. He found structural changes in the face and the mouth in those monkeys that had these silicone plugs. He found that they had notches in their lip. He found that their face was sunken. He found that their dentition was crowded, and that it just kept on getting worse and worse as they were breathing through their mouth more and more. So this was an orthodontist back then in 1984, and you know what happened in 84, right around then everybody was sensitized to cruelty to animals, so everything got put aside, but we're still doing it to humans. I was a mouth breather. Nobody ever said I shouldn't. I used to have nightmares that bugs would crawl in my mouth when I fell asleep. Never thought anything of it. I just thought everybody breathed through their mouth. My mother never said anything. Oh, like this all the time. You can see my pictures. I got a short lip. I got the whole works. These are what happens to your face, to the human face, with mouth breathing for whatever reason. And this epigenetic change needs to stop occurring. So we need to get to these kids as soon as possible to make these changes so that it doesn't get imprinted into the DNA into future generations. This is a really critical time for all of the kind of changes that we've been talking about in the last 6 hours. We know that the volume of the sinuses doesn't continue to grow in a mouth breather. So these are just a couple of studies here that look at sinus volume size as mouth breathing occurs. And I just keep looking at this picture and I'm thinking, what if you were a mouth breather your whole life and now your sinuses are only the size of a 12-year-old? And now you're 40. And now they want you to run a mile. What are you supposed to do? Where are you going to go now? There's nowhere else to go. In this study here, they found that 87% of mouth-breathing children were in trouble. They had hypertrophied adenoids. They had 77% had maxillary sinusitis. 55 had hypertrophied interior concha, and so on down the line. If you don't use your sinuses, you will lose them. If you've read James Nestor's book, that's exactly what happened to him. Everything shrunk down, and he had to have his maxilla and everything expanded in order to get really good breathing. And really good breathing requires the diaphragm. I don't know why I didn't really pick up on this in all of my physiology classes, but the diaphragm drags down, or it contracts down, and it drags air into your lungs. So it's doing the opposite of what you think it's doing. So it's really just, it has to be very flexible, it has to be very strong, and as it's moving up and down, it's also massaging the GI system. It's massaging everything underneath. So diaphragmatic breathing is really huge. And I found a tiny little video here of how that kind of works out. As the diaphragm goes down, it drags air in with it. And then as the air comes in, it brings in oxygen and the nitric oxide if you're breathing through your nose. And then it triggers, sorry, I'm going to follow the air. It goes into your lungs and goes through your body. And it picks up those red blood cells that are carrying the oxygen throughout the rest of your body, pick up CO2 and bring it into the breathing center of your brain, and that's what triggers another breath. And what we're seeing today is, what's very common today is that whatever's common is now considered normal. So the normal respiration rate in the 60s and 70s was between 9 and 12 breaths per minute. Today, you can find all kinds of documentation that 12 to 15 is normal. But the slower you breathe, the better you're breathing, the better your oxygenation. The lower third of your lungs has more blood vessels and more interaction with these blood chemicals or blood gases than the rest. So let's take a tiny little trip through the sinus system, and we'll remember that the sinuses look like that. Each little bubble has its own little name, and very often we get mucus in our sinuses, right? And then what happens? Sinus volume decreases. So now you don't have a lot of air. So now you're mouth breathing, right? But it's also the other way around. There's also a chicken and egg kind of a situation here, in that if you don't use your sinuses, they're going to fill up full of mucus because they can. Because why not? Let's just do it. So that's another reason why we need this nitric oxide to be in the mix, because it does help relax all of the smooth muscle, and it also makes it harder makes it unnecessary for the mucus to form. It makes it so that it kills everything so that there's no reason for the mucus to start showing up. It increases nitric oxide, arterial oxygenation tension, and reduce pulmonary vascular resistance. These are the regions that are most affected when we're talking about sinuses and nasal breathing. The oral pharynx is way up here. This is where we want the air to go, through the oral pharynx and down through the laryngopharynx. We have the epiglottis that needs to stay out of the way, and this is where all of this nitric oxide is formulated, right up in here. Imagine my surprise when somebody one day said, hey, ear infections is a respiratory infection. And I was like, what? And then I was like, really? What are you talking about? And then they were like, oh yeah, remember the eustachian tube goes right into the back of the sinuses. And I was like, doggone it. Okay, so now it's a respiratory infection. Now what are we going to do about it? In this paper here, Sinusology from 2016, they talk again about how important nitric oxide is and how it interacts with the bacteria that come in contact with it, and how the sinuses are such a good reservoir for nitric oxide. So what's in there? Who looks at patients' sinuses, or who looks at their nares? Who even uses the word nares? Don't you use nostrils? I don't like the word nares. I don't know. Anyway, now I look at nares all the time, and I'm like, what? Why are they so skinny? So this is the other view of the sinuses, and this is what we see as the nasal septum in health, and that's what gives us a lot of the room. And then sometimes this happens, and then the septum isn't exactly straight anymore. And then they go to the doctor, and the doctor resets it so that now it's straight. Two things. One, you don't need to have damage in order to get a deviated septum. If there's a mismatch in growth between the midface and the top of the head, you're going to get the septum that's trying to grow, and then this part doesn't grow. And this midface doesn't grow if the tongue is low. The tongue needs to press up against the palate. That's who was teaching anatomy? Dr. Titus taught us in my hygiene program in 1985 that the tongue has to go on the palate in order to stretch the palate, and then the cheeks would counter that on the other side. But if you can't get your tongue up there, you're very likely to have a deviated septum. And you're going to have this high, narrow arch, which is going to impinge into the sinuses. The idiopathic deviated septum messes up with the craniofacial respiratory complex. And sometimes you get it looking like this just because. And I know we've all run into people that were like, yeah, the doctor says I have a deviated septum, and I can't remember any time I fell or any time I had a hockey accident or something like that. But that's how that kind of happens. The other thing is that even once this thing is repaired, nobody tells the patient to breathe through their nose. You know how patients are, right? You tell them, now you can breathe through your nose, and they're like, yeah, I can. And then they and then they hang their mouth open. Somebody needs to say, now you should breathe through your nose. That the nose is really important, and that can be our realm. You know, they have to hear it a bunch of times. I don't know if you've ever had a serious illness or a surgery, and then they tell you all of this stuff, and they put a big binder together, and they give you all this stuff, and they say, here, read all of this. And you don't remember more than 10%, so it's worthwhile for us as a dental professional to remind them to breathe through their nose. So you can clear the sinuses in a couple of different ways. It does it on its own with cilia. Remember cilia? And look at this. This is a very old photo. We've had coronavirus around for a long time. So this is a virus. These are bacteria. The mucus is produced by these goblet cells, and then the cilia move that back. Okay? So the mucus traps a bunch of stuff, and it's self-cleansing. Now, we're in Florida where they never have the furnace on unless you're my mother. I got to Florida yesterday, and she had the furnace set at 80 still. I'm like, what am I doing? If you're in Wisconsin where you really need a furnace, your mucus dries up. And then the flow stops happening, and it doesn't really catch all of the bacteria. You still have the nitric oxide at work, but you're missing this one component. Okay? And then all of this stuff kind of bounces along. And so really now you really do need to breathe through your nose. You can use, I do have products in here. Nobody paid me to put the products in here, but I hate going to a professional lecture and then I don't know how to solve the problems that were brought about. So clear sinus spray has xylitol in. Xylitol is the magic ingredient. This xylitol has been tested against influenza A infections. They've even done it in dietary form and still found human respiratory viruses reduced in people that, or in rats actually, who were using xylitol in their diet. Nasal irrigation with chronic sinusitis also showed that there were improvements in, remember the SNOT score? Statistical differences between the SNOT and the VAS. The scores were reduced significantly, and the concentrations of nitric oxide were also increased. So once you get rid of that hard mucus, that hardened mucus that's lining the sinuses, you start to get more nasal volume, and you increase the ability for the cells that make the nitric oxide to produce and get into the sinuses. Clear had, the xylitol rather, had greater improvement in rhinosinusitis because of the nitric oxide compared to the saline. So what's happening is we had a face that was this size, and now we have a face that's this size. So not only do we have a smaller face, now we are breathing with their mouth open, and their sinuses are like, haha, I'm on vacation, I don't have to do anything. And it doesn't. And now you have even smaller sinus volume in your sinuses. So using xylitol Nasal spray is very helpful, as it is to also chew a xylitol gum, because you're massaging that eustachian tube as best you can. And this particular brand has a bunch of different versions now available. Nitric oxide inhibits replication cycle of severe acute respiratory syndrome coronavirus. So it's very effective against, between the xylitol and the nitric oxide, you've got a big double, triple whammy. When I am in the winter, I use a xylitol nasal spray all the time. And I breathe through my nose as best I can. I also tape my mouth at night still. So we can talk a little bit about that too. Now, if you breathe quietly through your mouth right now, and then go like this is called the cuddle maneuver, and just pull your nose apart a little bit, up, right up under your eyes. If that improves, then you might benefit from a nasal dilator or from nasal strips, particularly when you go to bed at night. What the doctors and what Joy was saying this morning is that people with sleep apnea or not breathing correctly while they're sleeping are losing a week or more of their life every night. They're not just doing a one-to-one. We need to improve their breathing as quickly as possible. This is what it looks like when it's placed. And it just gently holds the nares open, the nostrils open. And they also have a version for athletes called Turbo, I think. The company name is Rhinomed. Have other ways to open the sinuses too. This is pretty cool, this neti stick. It has eucalyptus essential oils in there, and you just open it. Remember Vicks sticks? It's just like that. You put it up in there, and everything goes, whoa! It's kind of temporary. And then this is a silver nasal spray that's also pretty good when necessary. These are also from Rhinomed, and they also are, somehow they're rechargeable. I don't know how that works. And they have essential oils somehow in them. Blowing your nose. Is anybody teaching their little kid patients how to blow their nose? Probably nobody's even looking. So blowing your nose is pretty important for little kids, and encouraging them to blow their nose, especially if they're snotty or if they're breathing with their mouth open, to ask them if they can breathe through their nose, and if they can't, can they blow their nose? I don't recommend this, but it's a fun picture anyway. Does everybody know how to unclog your nose using Buteyko method? So everybody sit up. We're going to do this really quick. While you're getting situated, I'll just remind you that when you blow your nose, use hand sanitizer, especially now, and then throw it away. So this is called the nose clearing exercise. It is to be done in a sequence of six rounds. So this was something that Dr. Buteyko developed, and it is to breathe through your nose as best you can, and then exhale, pinch your nose, and then bob your head for as long as possible. Go ahead. Everybody's doing it. Everybody's doing it. Bob and bob and bob until you absolutely can't. And then let go of your fingers. Breathe in through your nose. Keep your lips together. And then wait about 30 seconds. If you have super high uncontrolled blood pressure, stop doing it right now. And if you're pregnant 9 months, you should stop doing it right now. So let the air go in, give yourself 30 seconds, and then repeat it after 30 seconds. And I'm going to walk you through at least 3, because it seems like at 3, it's like magic. Just make sure you don't open your mouth at all during that time. And the other trick is to exhale before you hold your nose. The bobbing does not have to be violent, just has to be a little bit of motion. By the 3rd time, if you are congested, you'll hear everything kind of let loose. And then do it 3 more times. You can do this every hour. You can do this for your gagging patients before the appointment to just have them clear their sinuses, and then they won't be so protective of their airway. Yes? I'm sorry? Buteyko. Buteyko. Russian, not Japanese. So it's pretty simple, right? I've had people have raging sinus infections who had to fly across the country, and they were able to get on the plane and not have to take any antibiotics. They were able to breathe better for about 45 minutes. They had to do it a lot, but they didn't want to take the drugs. I had a little 4-year-old patient who was able to sleep for 2.5 hours before his mouth popped open. So this is one of the things we ask our patients to do right before bed. And the xylitol. Using the xylitol nasal spray, squirt, 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 in each nostril before bed and first thing in the morning, and you just keep everything flowing, and you have fewer allergy symptoms as well. Plus you get more nitric oxide and everything. So it's really beneficial to keep the sinuses functioning and support the function of the sinuses so that you get the nitric oxide and you can breathe in through your nose. Social distancing isn't always possible, and this is what I was saying about holding your breath in a crowd. When you get on an elevator, if there's 5 people in the elevator, you know, these elevators have 4 dots. Sometimes somebody squeezes in, can hold your breath, and then get a nice hit of nitric oxide. This is one of the first studies that they did against this particular virus, looking at nitric oxide against it. How can you tell if your patients are mouth breathing? Well, most of us are not going to look here. They're not going to look at the adenoids. So this is what happens to create mouth breathing and as a consequence of mouth breathing. So it's a double whammy. If you can't have them breathe through their nose for 2 minutes or so, then we really have to get an ENT involved. Pre-op evaluation of adenoid disease is, you know, you can tell by the sound of their voice, their tone, their adenoid faces, their overbite, their long faces. They usually have dry lips, or they lick their lips like crazy. They have this big red circle around their lips. Does that even happen down here in Florida, or is that just an up north thing? You know. Extensive decay is also a symptom of mouth breathing. It's not something we usually think about or talk about with our patients, especially at night. I posted on a Sjogren's Facebook page about whether or not they sleep with a fan. Almost everybody did. So their mouths are open more often than not. They're already dry, and now they've got this fan going. So these would be good people to make sure that they have their lips closed at night. Perioral dermatitis can also happen with a lot of saliva and licking and toothpaste and stuff. People who breathe with their mouth open have no idea. They will deny it. For sure. You'll even say, well, do you ever have your mouth ever feel dry? Well, in the morning when I wake up, I'm usually pretty thirsty, but it goes away right away. You're like, hello, that's mouth breathing. So there's all kinds of hurdles. So these are ways to not tape your mouth at night. You're not to use duct tape. You do not need a 2-inch wide tape. This is pretty close. This is unnecessary. This is very unnecessary. You don't need a big wad of it like this. You don't need this blue painter's tape. They have tape now that's purposefully used for sleeping. The Somnifix is a really good one. I like that one a lot. I use the 3M micropore paper tape. When I use the Somnifix, I save it and I use it over and over. I can get 3 nights out of it. This is the way I tape my mouth. I put one full piece right across my lips. Most people don't need that. Most people just need a little tiny piece that goes up and down like that, just to add a little bit of a reminder. For people that are freaked out by it, you can ask them to just try it for half an hour, 20 minutes during the day. Just put one little piece of the 3M micropore tape. Not 3M micropore Nextum tape, or whatever that, Nexcare, I guess. That stuff sticks like mad. So a trick to all of the tapes, except for the ones made specifically for mouth taping, is to tape it onto the back of your hand first, and do that 2 or 3 times before you put it on your mouth. It comes off a little easier. You'll notice too that, see, this is bent here, this corner is turned over. That's partly to get it off of the roll, and it's also to get it off of your face. So it's easy to get off in the morning. Sometimes people are like, what if I have to vomit? I'm like, when's the last time you vomited in the night? And they're like, well, you just never know. I'm like, take it off. So some people are very freaked out by it. A lot of practitioners were asking their child patients to also tape their mouth, and their parents would tape their mouth in the night. And then they were reported to child services. And so we have a new tape now called Myo Tape. And it's kinesio tape. It goes right around the outside of the mouth. It's stretchy. The child can still talk. They can still not freak out in the night. And they can have a little bit of pressure onto their lips. I don't see the lights flashing. Oh, it's an amber alert. So this is another, they have a child size, and they also have an adult size. I think you can get it from myotape.com and from Myo Made Easy, with 2 E's in the middle, myomadeeasy.com. They have child and adult. Who shouldn't use mouth tape are people who can't breathe through their nose. They're super Wisconsin size. They have low blood pressure, heart problems, severely chapped lips, over imbibement. So let's see, we've got time for this other little body oxygen level test. That's mine, I guess. So I'm going to have you just sit up again. So this is a good test to see how well you and your patients are oxygenated. And it is another breath holding test. But this time you're only going to hold your breath until you get the first urge to breathe. So if you are a 10 breaths a minute person, you breathe every 6 seconds. You take another breath. So don't take that breath. Wait until your body says, hey, where's the air? So it kind of looks more like this. So at your next exhale, go ahead and just pinch your nose and count the seconds until you get that first, hey, where's the air, kind of a thing. It's not a contest hold. It's just, hey, how's it going? Where's the air? Okay? And then let go of your nose at the appropriate time where you can't, where your body's like, I need some air. Now, we know that these seconds mean something. These seconds can tell us a whole heck of a lot. So I learned about the ASA score and the BOLT scores at separate times, or the control pause. It's 2 names for this one. So we want normal, healthy people to have a good 40 seconds. I've not run across more than 2 or 3 people that have 40 seconds. I almost never take the first reading when I'm doing this on my intake. Mild systemic disease can be anything, you know. So we want that to be at least 20 or 25. And then as we get shorter and shorter amounts of time, they're sicker and sicker. The other gas, so this is the carbon dioxide. We always were taught of it to be more of a waste gas. but it does have a couple of jobs. It triggers the breathing center for one thing. It also prevents smooth muscle from going into spasm. So in case you forgot what smooth muscle is, I will help you out because I had to go look it up again too. It's all the muscle from about here down to here. So the other place is around the cardiovascular system. So if you don't have enough CO2, which is what we were just doing right now, we were kind of measuring your tolerance for CO2, you have a higher blood pressure. So if you're over breathing, this is the connection with breathing and blood pressure because these muscles are cramping. Some people have weird GI stuff. It could be that they're over breathing. These naturopaths and these health coaches and everything, nobody's talking about chewing and nobody's talking about breathing. They're taking deep breaths and they're talking about breathing during meditation, but what are you going to do the rest of the day? How are you supposed to breathe the rest of the day? How do you get rid of CO2? Talking too fast. Some people have such a sensitivity to the CO2 that they always just talk and talk and talk. And they just dump CO2 over and over. Frequent deep breaths. This was me when my teenagers were teenagers. Just all day long I'd sigh over my patients and they'd be, what's wrong? And then I would say, well, I have teenagers. Oh, so that solved that. But I was probably trying to get rid of the CO2. Snoring also dumps CO2. Can be consistently tired, have a lack of energy. If you don't have enough, it'll disturb your sleep patterns. And CO2 hangs on to the red blood cells. And it hangs on tight. It travels from the muscles onto the red blood cell, up in through the brain, triggers the breath, comes down, releases, and swaps out in the lungs with oxygen. So that's the genericest way to say it. If there's not enough CO2, oxygen has no reason to let go. So we need to have the right kind of balance there. So mouth breathing interferes with oxygen's release into the muscle. Nitric oxide is the other gas that almost nobody talks about when we're talking about breathing, but it also benefits the cardiovascular system. It helps release the plaques, or not release them, it helps them, stops them from growing. And as you age, you have less and less nitric oxide, so it's more and more important to find ways to get some, like breathing through your nose. It also helps relax the cardiovascular system. So it's really a pretty intense gas, a really important gas. A way to promote more nitric oxide is to hum. You can increase your nitric oxide by humming 60 to 120 times a day. You don't have to sing a song, you can. It improves sinus volume because it's vibrating all of the mucus and keeping that flowing. Increases nitric oxide by 3,000 parts per billion. Increases nitric oxide between 7 and 15 times. So the whole real thing is to get to the first domino. We see patients more than any other healthcare provider or professional, and we can do a little bit more. I spoke to the hygienist earlier today, and I'm like, if you don't talk about flossing and you don't talk about how much they hate flossing, you just bought 10 minutes right there. You know, people are going to floss or they're not. You have to teach a 12-year-old how to do it right. You don't have to do anything with a 40-year-old. Now we have to start talking about breathing. We have to start talking about sleeping. We have to start talking about some of these higher level things. And we have to get to these little girls so that when they get to be mothers, they already know this stuff. That to me is a higher calling. This is Sierra doing her Buteyko exercise. She's got a card in her mouth because her lips won't stay together. So sometimes we put a sticky note on the lips, sometimes we flat out tape it, and sometimes we just have them do it with a card in between their lips. So she didn't do it right. Her first breath was through her mouth. Did you catch that? So this is how we test kids. They don't sit here and hold their breath like that. We have them count their steps after an exhale. And then we bill them that. So you can tell she's my granddaughter. She's not happy. Grandma. So in summary, now you know what to do, how to refer. So I have a couple of these at the table in there, and they're just little reminders of what it is to look at, tongue activity, the swallow, what grading system you would use, and then the indications that go along with myofunctional disorders. I don't have any of these forms with me, these referral forms. Obviously, I'd be happy to send you some. And we really just work on the respiratory fitness of our patients, not just tongue placement. Respiratory fitness means you can exercise at your customary pace with your mouth closed. That first 10 minutes of a run is brutal with your mouth closed. If you can make it past that first 10 minutes, you're going to be in heaven. You're going to find what my son found. He called me out of the blue. He's like, I just got back from my ride. He rides in the mountains in Auburn, California on his bike on the roads. And he goes, I had my mouth closed the whole time. I'm like, okay, sounds good. He goes, but I think I cut my root in half. I'm like, what are you talking about? He couldn't put the pieces together with how much energy he had, the time it took for him to do it, and what the odometer read. The odometer said he went the distance. The clock said he did that much time on the road, but he had so much energy he couldn't believe that all of those things were accurate. And even now, it's 3-5 years later, he's still, that first 10 minutes is really a struggle, but he gets it done. Mouth breathing is normal breathing. I said that wrong. See how easy that is? Nose breathing is normal breathing. Mouth closed breathing is appropriate. These mammals are at their highest level of performance, mouth closed. Obligate nasal breathing improves immunity, builds up nitric oxide, and reduces dental decay. And you can stop mouth breathing in a couple of different things by getting to the root of the problem. Why can't they mouth breathe? Why can't they get their nose cleared? Practicing nasal breathing, keeping the nose and sinuses clear, and mouth taping. Those are some of the really easy key things that you can do. If you're not working with the myofunctional therapist, it's so easy. Everybody's working online now. Got to keep up that nitric oxide. Keep up that nitric oxide. Any questions? That's it. And keep your hands off your face. So that's the end of it. I'm sure you have a couple of questions, so I'm here to answer anything. Oh, look, I even have a question slide.
How does the nitric oxide affect the virus?
Okay, so that's highly technical. It kills it. It just wipes it out. The xylitol acts, so the current theory is that it acts like a surrogate marker and it attracts the virus to it. And then that's how it works on its kill. No, that's not the theory right now. Although it might be true. But it takes a lot of money and it takes a lot of professional curiosity in order to get these kinds of studies done. Not everybody has the money or the curiosity because it's cheap and you can't get a trademark or a copyright or anything like that on it. So that's still under investigation. Have a great night.